I know we all have that one favorite sleeping position, don't we? But as we age, we might have to face various health related issues, from minor illnesses like cold to severe health problems like heart failure. So, is there a better sleeping position for all these conditions? In this video, we'll chat about the simple changes you can make to your sleeping position to feel better. Hit that subscribe button to know more about better sleep positions for better health. First of all, I just want to tell you that if your current sleeping position gives you that good night's sleep and you wake up feeling good without any discomfort and tiredness, that's fantastic. Stick with it. But if you're struggling with neck, back, shoulder pain or heartburn, even pregnancy discomfort and your period cramps, then it might be time to start considering adjusting your sleeping position. Let's talk about neck pain. I get it. It's so disturbing because I've been there. But guess what? I found a few tricks that really helped me. I think they'll help you too. First off, if you're a back sleeper like me, finding the right pillow is the key. Look for a memory foam pillow with built-in neck support which matches the natural curve of your spine. It should be just the right size to keep your head and neck in the neutral position. Make sure the pillows are a bit higher under your neck than under your head so that your neck muscles can relax. And don't forget to put small pillow under your knees. It takes the pressure of your lower back. Now, if you're a side sleeper, make sure your pillow supports your head and neck, keeping them aligned with your chest and back. And put a pillow between your knees to make sure your hips and pelvis are in line. It decreases strain of your lower back joints. Trust me, it works wonders for lower back pain also. But what if you've got shoulder pain? If you're a back sleeper, try crossing your arms over your stomach, putting a pillow under your painful arm so that it lifts your arm and reduces the pressure on your shoulder. If you are a side sleeper, sleep on your pain-free hand. Hug a pillow so that your arm doesn't fall forwards and thus decreasing the strain on your shoulder. Let's see what you can do about the heart problems affecting your sleep. So if you have been recently undergone a surgery or if you have heart problems like heart failure, getting a good night's sleep is a challenge. When it comes to the sleeping positions, sleeping on your right side might help you. I know it sounds strange, but let me explain. When you sleep on your left side, your heart can move slightly due to gravity, causing changes in the electrical activity of the heart and thus causing changes in the ECG recordings. On the other hand, sleeping on your right side keeps your heart more in a stable position as it is supported by an internal structure called mediastinum. So this means no movements, no ECG changes. Now, what about sleeping on your back? While it might seem comfy, but it can lead to problems like sleep apnea. This is when your breathing gets interrupted during sleep, which can increase the risk of high blood pressure, stroke, and other heart issues. If you're dealing with breathing problems like COPD, elevating your head and neck with pillows can make a huge difference. This helps open up your airways and decreases symptoms like coughing and shortness of breath. When it comes to dealing with heartburn, acid reflux, or GERD, sleeping on your left side can make a huge difference. When you sleep on your left side, it helps keep your stomach lower than the esophagus. That means gravity is on your side, keeping the stomach acid from creeping up into the esophagus, which is all responsible for causing the uncomfortable burning sensations known as acid reflux or heartburn. Plus, sleeping on your left side also improves your digestion by encouraging the food and stomach acid to flow more easily through your digestive system. We all know pregnancy discomforts can get in the way of our good night's sleep, but there are a few tricks to help you out. First up, try sleeping on your left side with your knees bent. This not only helps with your own discomfort, but also increases the blood flow to your uterus and baby, making sure your baby gets all the required nutrients. Plus, it also decreases the swelling of your ankles and legs. Now, what about sleeping on your right side? It's not the best idea because it puts pressure on the liver. But if you need a quick rest, it's okay for shorter periods. And let's talk about heartburn. So if it is keeping you up at night, try raising your head end of the mattress or bed to help ease your burn. And it's a big no-no to sleep on your stomach or on your back. Once you hit a second trimester, it's a big no because the growing uterus puts pressure on your organs and spine, causing all sorts of discomfort, especially back pain and snoring and breathing difficulties. We girls all know about those nasty period cramps, right? One thing that can really help is you to sleep in fetal position. This helps relax the abdominal muscles and decrease the intensity of those cramps. Now, if you sleep on your side, it also decreases back pain and takes pressure off your tummy. Just make sure to put a small pillow between your knees to give your lower back some extra support. Now, if you're a back sleeper, that's okay too, because sleeping on your back with pillows below your knee helps relieve pressure of your abdomen and lower back. But hey, here's the bottom line. There is no right or wrong way to sleep. We need to find a position that's comfortable for you. So go ahead and try out these tips and see what works best for you. And don't forget to hit the subscribe button.